So why are they cheaper there?
Our economy here in Canada is probably hurting, and I think our dollar's being weakened, and therefore we get a lot of patients coming from the United States, as you know, wanting to get deep plane facelifts because we're like the Turkey to the United States. We're way cheaper for certain procedures.
I saw your work. I would stalk your Instagram. I would look at all of the results you got before and after, and I always was surprised at how quick I found people to recover with you.
Rhinoplasty is constantly evolving and changing. So some of the techniques that we did 10 years ago, we've abandoned and adopted some new techniques.
It doesn't mean that it's going to be easier because I traveled to Turkey. Well, first and foremost, I've always been a fan of Dr. Solomon's work.
Well, you look great.
You look terrific.
Thank you so much.
Thanks so much for sharing your story and participating in the podcast.
Thank you.
So fun, and I'm sure the audience will really appreciate your time. Okay, hi guys, it's Dr. Solomon here at Unfiltered. Welcome back. Today we're going to be talking to one of our patients about her experience with rhinoplasty and CO2 laser. I'll turn over the camera to Nancy, who's going to introduce her and ask some questions.
Hi, everybody. So this is Habibe. She's 27 years old. She recently underwent a closed rhinoplasty and CO2 laser resurfacing under the eyelids. I want to start off by talking a little bit about her, because we were talking at one of her post-op appointments, and she was telling me a little bit about her story. So she was born in Canada. Her family's Turkish, and she was deciding, I guess, that she wanted to make some changes to her nose. And she chose a Canadian surgeon over a Turkish surgeon. So we were just discussing what was the reason and what brought you to us.
Yes. Well, first and foremost, I've always been a fan of Dr. Solomon's work. I think it's always helpful when you get introduced to someone by someone that you trust. So for me, it was just a friend of mine, and I was able to see the results in person. And for me, it was always someone that just stuck in my mind from when I was quite at a young age in high school. And following that, I was really, the reaction I had from some of my friends from choosing to have my surgery in Canada was always like, well, you're from Turkey. Why wouldn't you go back to Turkey? They do the best surgeries. They do maybe 50 of them in one day. They're very experienced. Why would you choose Canadian technique over Turkish technique? And for me, it always came down to, it doesn't mean that it's going to be easier because I traveled to Turkey. I mean, perhaps there's an economic factor that people decide, I want to go to Turkey because I could get a trip out of it and I can pay less for the surgery. But when you consider everything that's involved in terms of recovering, in terms of what I'm going to look like, do I know this person? What kind of condition am I going to be in? I felt like I would be in the twilight zone, going to a place that I don't even recognize. So for me, it was important to me to have a very safe and comfortable recovery. So I always knew that it made sense for me to do it in Canada. I live in Canada, so it makes sense for me to recover in Canada. I thought that it would also probably help to avoid long flights. In addition to that, of course, it's your work. I honestly only did one consult in Canada, and that was you. I did one in Turkey over WhatsApp. And I just liked the way that you approached me. I think it was really, you wanted me to stay true to me, but you definitely saw the areas that I wanted to correct with my nose. And I think it was just like a simple thing. I saw your work. I would stalk your Instagram. I would look at all of the results you got before and after. And I always was surprised at how quick I found people to recover with you. And I know that I did some research, of course, and I know that you did some training back in the Middle East as well, if I'm right.
I've traveled sort of all over the place to sort of cultivate and enhance my skills. So including the Middle East, Europe, United States, and Canada.
And perhaps like there is differences in techniques that we use in Canada and in other parts of the world. But I think when you have someone who's interested in developing their skill set, you immediately want to trust them because they've kind of picked the skills all over. So that was the main reason that I decided to go to Dr. Solomon, and I'm so happy I did.
That's good. I do have some questions, so I can sort of break this down for our listeners and viewers. The reasons people go to Turkey, for which procedures, let's discuss. Typically, I mean, we often hear about rhinoplasty and hair transplants. Any other procedures that are commonly sought out there?
I think that they have a very blossoming aesthetic surgery industry there, and it's become very big for travel surgery. Hair being number one. I think they, for whatever reason, got into the marketplace of hair where it was almost commoditized and made into something that was quick, easy, set up well, had good technicians, and easy access, and the economics were good. So a lot of people would go there and felt like hair transplants, you're going to get a similar result wherever you go. That's a whole conversation. Like we can bring Dr. Corman, who does hair transplants at our facility, and then he would say it obviously is more complicated than that and really depends on which surgeon. So just because you have a country, Turkey, doesn't mean you're getting the same hair transplant or nose job at every single clinic. There's different doctors, different clinics, and so on and so forth. So I think the economics of it is probably the primary driver. And then I do think there are some good surgeons in Turkey who deal with a lot of certain types of noses, so Middle Eastern noses, and they've popularized some of the procedures, which initially were almost overtly aggressive and looked almost radically done. And some people like that look, like a Barbie doll, tiny nose for thicker skin patients, sometimes because of the volume of patients they were doing. And the aggressiveness of techniques that were popularized, maybe it seemed like a good place for certain types of patients with thick skin to want to go to. I don't think there's anything so unique about the techniques that they're doing. I think most of us share information across countries, across borders, across oceans. So a lot of the ideology and the concepts are not just location specific. So we have patients who've had surgery in Turkey who come see us who may be happy. We have other ones who may not be happy, and often we'll go through the surgical notes if we're able to get them. And a lot of the techniques are very similar to ones that we may utilize as well for very specific types of noses. So I don't know if that makes it simpler for you to understand it, but I think noses and hair transplant were probably the two commonest procedures that had a lot of travel.
So why are they cheaper there?
Well, I think it has to do a lot with just the economy of Turkey. I think their economy wasn't doing great. I think under Erdogan, there was issues with inflation and their dollar was different, like had a pressure on their dollar, which made the Canadian dollar, US dollar much stronger. And that allowed it to be done for way cheaper with the currency differential. I think some of the very well-known surgeons in Turkey who are known to do good work, the fees have gone up a lot. So I don't think the differential is as broad as it used to be.
Do you think the tariffs are going to affect us now?
Well, there's no tariff specifically on cosmetic surgery that I'm aware of. I mean, I think the patients, our economy here in Canada is probably hurting, and I think our dollar's being weakened, and therefore we get a lot of patients coming from the United States, as you know, wanting to get deep plane facelifts, rhinoplasties, because we're like the Turkey to the United States. We're way cheaper for certain procedures. But again, like the deep plane facelift operation in LA, New York, some parts of the United States are hundreds of thousands of dollars, and we're doing it for 30,000 to 40,000 Canadian. So there's a huge differential. Nose jobs in the United States with certain surgeons in Manhattan that are doing very similar types of operations to what we're doing here in Toronto, maybe charging double or triple the prices. So, we're kind of the Turkey to New York City, I guess. So there's a bit of travel.
Good way of looking at it.
Yeah. So I think that's really more what's involved. The biggest issue with travel surgery is if you get a complication or don't have the outcome you want, you're having to travel back. And there is obviously a role of aftercare, like being able to see the patient and see how they're doing as they go through the healing process is important. And if you're in a different country, you can do Zoom and things like that, but it's not the same as seeing someone in person.
Could you imagine if you had a complication? I mean, thank goodness you didn't, and you've had such a beautiful and smooth recovery. But if you had done it in Turkey and you're here, now that you've gone through the experience of having rhinoplasty surgery, you're kind of left, you're left on your own to sort of navigate that. And we do see a lot of that. We get more and more phone calls every week of patients who've had their surgeries elsewhere, and they're looking for some type of post-care support here, whether it's an injection of some kind or suture removal, or they just need some guidance.
For me, I just feel like I wouldn't book a surgery in a location that I wasn't willing to travel back to. So I think in that sense, it is a commitment to travel and to choose a surgeon that lives not in your native city or country. However, I do think that maybe for more renowned doctors and specialty that you are looking for to be specific to yourself, I do understand why people would want to travel. I mean, I have a friend of mine who has a thick skin style nose, which I've learned through my journey of rhinoplasty. And it is true that there are doctors who are known to be able to accomplish a look with the infrastructure that you already have and the and the qualities of the nose that you have. So I do understand people who do travel. However, if you can't go back in case of a complication, I would say don't do it. I think you need to kind of be willing to have that investment in a situation like that.
Well, it's interesting because we live in a city with lots of ethnicities. So
Yes.
Dr. Solomon's been doing this for over 25 years. I can promise you he's probably done a ton of patients with thick skin, probably the same, the same demographic that they would see in Turkey. So the techniques that people think or are led to believe are different in Turkey than Canada, are they that significantly different? Are they different? Can you do the same thing here?
Listen, I don't think there's any magic to the surgeries being done there. I think there's some very experienced surgeons here and there's experienced surgeons there. Rhinoplasty is constantly evolving and changing. So some of the techniques that we did 10 years ago, we've abandoned and adopted some new techniques. One of the big differentials for thick skin patients is something called a septal extension graft, which when I trained, that didn't exist. People were doing, or it existed, but it wasn't really employed on a regular basis. And that's when a piece of cartilage is taken and sewn to the anterior edge of the existing septum to allow you to really reposition the entire tip complex at a higher position, and it tends to stay. When I trained, we were putting in what were known as struts, so it was more of a free-floating piece of cartilage. And so it may sound almost like very slightly different, but it has a big impact. So I think some of the surgeons in Turkey were employing the septal extension grafts before it became popularized in North America. Now many surgeons are utilizing septal extension grafts. You go to meetings, that's almost like standard for especially for thicker skin patients.
Sorry to interrupt, but for thicker skin, is it usually that they don't have enough cartilage, or is it because their skin itself is just much more compared to the amount of cartilage they have?
Yeah, so it's a great question. And in general terms, patients who have thicker skin have weaker cartilage, and patients who have thinner skin have thicker, stronger cartilage. They kind of go like that. So patients who have thick skin and weak cartilage, like an African American patient, we're having to really overly structure the nose, either by adding cartilage from another body part or using as much of their septum as possible to create almost a tent post appearance, like putting a post up under a tent and you see it poking through to create that definition on the tip. But if you have weaker cartilage or if the cartilage is free floating, it may not give that tent post. Whereas when you have a septal extension graft where you've added the cartilage as part of the actual structure of the nose and it doesn't move, your nose becomes more rigid, which is the downside, but you're able to really create more definition of the tip. That's the biggest nuance. But I can tell you, when I trained with two specific surgeons in Toronto who did a lot of ethnic rhinoplasty, they were doing extremely aggressive operations to create tip definitions, which created as triangulated and defined tips that were, still to this day, I think some of the most defined aggressive operations that I've seen, whether I'm going to a meeting and people are talking from Turkey. There was a surgeon who popularized this, Bob Simons, who was a facial plastic surgeon in Miami, that had a lot of patients from South America, was doing what he called the modified Simons tiplasty on almost all the patients who were like South American, who were living in South Florida at the time, and he was creating these super defined tips. But again, a lot of times it took months to years before the definition even showed. Wow. So we sometimes see people that we've done some of these techniques, and they're not as defined as the patient wants, but it may be as defined as they're going to get, whether it's done here or there. And then the other new sort of thing was utilizing medical management, such as cortisone injections, 5-FU injections. These are different drugs that will reduce scar tissue. And lastly, Accutane, which we've talked about in the past, which can make a huge difference for patients with thick skin. So they get the surgery done, and then their skin's still thick, and then they go on Accutane and they create more definition.
What about spironolactone?
Yeah, I haven't really used spironolactone while it's used for acne. I haven't really used it specifically for rhinoplasty, but Accutane we use frequently.
Okay.
Let's talk about Habibe's nose. Let's show what her nose looked like before surgery.
Oh, I'm so proud of it.
This is just 2 weeks after. Or was it 2 weeks?
Yes.
4 weeks?
Yes.
Something like that.
Yeah, I think, around that.
So let's discuss what you did for her. She had a closed rhinoplasty. Is that right?
Yes, that's correct.
Yeah, so that means all the incisions were done internally. There's no cut across the base of the columella. The cartilages of her tip are reshaped internally with some suture and reduction of the cartilage width. The bridge of the nose is lowered to create a bit of a slope, and the nasal bones are mobilized as well. to give some narrowing from the front on view. And
I
I think she looks super
Yeah.
cute.
Yeah, it's
This
adorable.
before and after is what made me decide to do the podcast, because I was so proud of it that I wanted other women to see what you can accomplish with your nose. Because I remember we discussed that it was potential that I could do an open rhinoplasty, just because I felt like the tip of my nose was almost falling when I would smile, making my nose look almost super long and very close to my lip when I would smile. And that was really bothered me. And I remember like, well, it's possible. We'll see when we go in. And when we came out, I was really happy that you decided to do a closed surgery. I mean, I know that there's definitely a lot of technicalities that go with it, but I think it helped my recovery so much.
Okay.
Yeah.
Well, I'm glad that we chose the right operation for you and that you're happy with the outcome.
Yes.
I just want to touch on the other procedure that she did, because we
Yes.
mentioned at the beginning of the podcast, she also did CO2 laser for the lower eyelids. Were you experiencing some crepey skin, some fine lines? Is that what you were looking to address?
The problem I wanted to address was my concern for the milia I had under my eye since I was a child. I don't know what caused it. It's possibly just genetics. My mom has it. And it's something that I'll probably have to keep working on, because I think that it's really deep within my skin. But I do notice a smoother appearance in my skin. The right side of my eye looks a lot smoother. The milias are smaller. I think for what I have, I see that it's quite limited what is out there to treat this. I'm not sure how prevalent it is, but I find that for me, it's been extremely stubborn. And I'm like, I'll do anything to remove it.
You look pretty flawless now.
Yeah, you look
Beautiful.
terrific. And for
you.
those of you wondering what we're referring to with milia, those are like white keratin plugs, like little bits of skin that are growing internally. Like not blackheads, because that's a different type of debris in the skin, but little white cutaneous irregularities. And they can be picked out with a little needle or a needle with an energy device such as cautery or radiofrequency, but that can leave little marks on the skin. Yes. So when patients have a few of them, that's what we would choose to use, is the Elman machine or a radiofrequency ablation. But because you had a whole bunch of them, we thought the resurfacing with the CO2 may be a better option and reduce the chance of leaving little marks.
I did also, actually, I had a trip to Turkey, and they did attempt to do the needle for each one. But I did find that I only decided to do a few because I wanted to see how I would react. I'm a pretty cautious person when it comes to these things. And I noticed that I did have like red marks forming. So I decided to lay off on it and just continue with my eye creams until I found something that would work. I've also been sold on other nano lasers from aesthetic clinics, and they didn't really help. I feel like so far the CO2 has given me the best results. But like anything, it is a maintenance. It's something that I think can also form from certain eye products, creams, genetics, and so forth. Yeah.
Well, you look great.
You look terrific.
Thank you so much.
Thanks so much for sharing your story and participating in the podcast.
Thank you.
So fun, and it was so nice having you. And I
Yes.
think you probably will look back on it later in life, and it'll remind you of this time in your life. So thanks so much.
Yeah.
It was
Thank you.
super fun.
Thank
I'm sure
you.
the audience will really appreciate your time and sharing your story.
Yes, of course. Thank you.
So thanks for tuning in to Unfiltered, and we will see you back shortly.